4. Red flags for bowel cancer that can appear years before a diagnosis. Bowel cancer, which is also known as colorectal cancer, is the fourth most common type of cancer in the UK, accounting for around 11% of new cancer cases. However, it is the second most deadly, causing the deaths of around 16,000 people every year. Researchers from the Washington University School of Medicine in St. Louis believe these red flags may hold the answer to earlier detection and diagnosis of early-onset colorectal cancer among younger adults. As part of the study, published in the Journal of the National Cancer Institute, the team analyzed data on more than 5,000 patients with early-onset bowel cancer, classified as cancer that occurs before the age of 50. They determined that anywhere between 3 months and 2 years prior to diagnosis the patients were likely to experience 4 symptoms. These were abdominal pain, rectal bleeding, diarrhea, iron deficiency, anemia. It was determined that having just a single one of the symptoms almost doubled the risk for bowel cancer. Senior investigator Yin Cao explained, "Colorectal cancer is not simply a disease affecting older people. We want younger adults to be aware of and act on these potentially very telling signs and symptoms, particularly because people under 50 are considered to be at low risk, and they don't receive routine colorectal cancer screening." It's also crucial to spread awareness among primary care doctors, gastroenterologists and emergency medicine doctors. To date, many early-onset colorectal cancers are detected in emergency rooms, and there often are significant diagnostic delays with this cancer. Cao said 2 symptoms in particular, rectal bleeding and iron deficiency anemia, a condition in which there are not enough healthy red blood cells to carry oxygen, point to the need for timely endoscopy and follow-up. However, since 2021 the program has been gradually expanding to include people aged 50 to 59. If you are eligible you will be automatically sent an at-home screening test kit. First study author Cassandra Fritz added, "It usually takes about 3 months to get a diagnosis from the time a person first goes to the doctor with one or more of the red flag signs and symptoms we've identified. But in this analysis, we found that some young adults had symptoms for up to 2 years prior to their diagnoses. That may be part of the reason many of these younger patients had more advanced disease at the time of diagnosis than what we normally see in older people who get screened regularly." According to the American Cancer Society, although the death rate from bowel cancer has been dropping for several decades in older adults, more younger people are diagnosed with the disease at advanced stages, and many are dying of the disease. Since the majority of early-onset colorectal cancer cases have been and will continue to be diagnosed after symptom presentation, it is crucial to recognize these red flag signs and symptoms promptly and conduct a diagnostic workup as soon as possible, Cao added. By doing so, we can diagnose the disease earlier, which in turn can reduce the need for more aggressive treatment and improve patients' quality of life and survival rates. The NHS lists the main symptoms of bowel cancer as changes in your poo, such as having softer poo, diarrhea or constipation that is not usual for you, needing to poo more or less often than usual for you, blood in your poo, which may look red or black, bleeding from your bottom, often feeling like you need to poo, even if you've just been to the toilet, tummy pain, bloating, losing weight without trying, feeling very tired for no reason. If you experience any symptoms of bowel cancer you should see your GP.